As you have rightly heard, my name is Sunday Ochono, and I work with the International Center for Antimicrobial Resistance Solutions. You will get to know more about it in the course of my presentation. And I also serve as the coordinator for the One Health team, focusing mostly on agri-food sector and also the environmental dimensions of AMR. And in the course of this presentation, I wish to address the antimicrobial dimension or the environmental dimensions of antimicrobial resistance and its interlinkage with climate change. So at the end of this, I hope that we'll be able to describe the mutually antagonistic relationship between climate change and antimicrobial resistance, but also to understand the impact of climate change and AMR on the achievement of the Sustainable Development Goals, the SDGs, and also to expand and elucidate existing and also proposed One Health interventions and solutions to mitigating the dual threat of climate change and AMR. So when we talk about One Health issue, you agree with me that AMR is the quintessential One Health issue that borders around human health, animal health, and environmental health. And when we take a closer look at the human health, it compromises the effectiveness of antibiotics, which leads to longer hospital stays, higher medical costs, but also increases mortality. And when we look at it from the animal health perspective, we look at it mostly from overuse and misuse or abuse of antibiotics in animals and aquaculture, which contributes to resistant bacteria, which can spread to humans via food contact and also the environment. And now, if we look at the environment, which I often refer to as the nexus of the One Health framework, is that antibiotics and resistant bacteria from human and animal waste enter the environment, which then further spread or increases or exacerbates the spread of resistance through soil and water systems. And if we look at it from a more interconnectedness aspect, human, animal, agri-food, and environmental health, as well as climate change, are deeply interlinked, which makes a One Health approach very critical if we intend to tackle AMR mostly at a global scale. Just to give you some perspective, when we talk about the environmental dimensions of antimicrobial resistance, we know that the key things or key transmission pathways to look out for is that we have the agricultural runoffs, which bring about antibiotics and resistant bacteria into the environment. And then we look at healthcare sectors and systems as pharmaceutical facilities that discharge antibiotics and antimicrobials into the environment. And then we also have another big component, mostly coming from the agri-food sector, which is the soil contamination through manure and biosolids that come from animal waste. And then we look at the airborne transmission through dust and aerosols. Now, what happens in the human and animal health or the risk that it poses is that there is a direct exposure through contaminated water and food, especially with the drive around organic food and all of that, and with short-lived vegetables, there is quite a very high risk in consuming food that are contaminated with these elements. Also, we look at treatment-resistant infections that are on the increase in both humans and animals. You look at compromised food security and safety, economic impact on healthcare and livestock production. And if you look at the environmental impacts, we look at it mostly from the disruption of natural microbial communities and biodiversity. I will expand on all of this in the course of the presentation. But we also have to consider the accumulation of resistant genes in environmental reservoirs, and also the altered ecosystem functions and nutrient cycling that antibiotics and antimicrobials have in the health, the environmental sector, and also we look at water and soil quality degradation. Now, if I will give just a very quick on climate change, we first realized that when we talk about climate change, the solar radiation reaches the Earth's atmosphere, and most of this radiation is absorbed by the Earth's surface. which now warms the Earth's surface. But then as soon as that happens, some of the Earth emits some energy as infrared radiation, and some of which escapes back into the space. But in the course of doing that, some of the infrared radiation is trapped by greenhouse gases in the atmosphere, which causes Earth's surface, and it also lowers atmospheric, and it affects the Earth's surface and lower atmosphere, which also causes it to heat up. Now, the danger here is that human activities are increasing levels of greenhouse gases, which leads to the trapping of extra heat, which leads to the raising of Earth's temperature. But now, if we look at climate change, we realize that climate change is adversely affecting water availability and food production, health and well-being, cities, settlements, and infrastructures, as well as biodiversity and ecosystems, which explains that climate change affects every aspect of human and animal life. Now, if we look at it in terms of water availability and food production, we know that it affects physical water availability, agriculture and crop production, animal and livestock health and productivity, fisheries yield, and aquaculture production. But if you look at it from human health and well-being, it causes increase in infectious diseases. It causes heat, which leads to malnutrition and also harms wildlife and increases the risk of wildfire. And also we have mental health that is greatly affected by climate change. It also causes displacement. And if we look at it from cities, settlements, and infrastructure, we see that inland flooding and associated damages have increased in recent years. We see increase in flood, in storms, induced damages in coastal areas. We also see damages in infrastructure, as well as damages to key economic sectors. But that's not the end. We also see significant impact on terrestrial ecosystems, freshwater ecosystems, as well as ocean ecosystems. And that is why the IPCC, which is the Intergovernmental Panel on Climate Change, released its climate change report synthesis that summarizes the current challenges of climate change and its widespread impacts and risks. And we see that human influence has resulted in escalating greenhouse gases, which has led to unprecedented increase in temperature, rising sea levels, and extreme weather, all of which are occurring much faster than anticipated and much faster than we are able to mitigate. And you will agree with me from what you can see on this chart that between 1970 and 2019, we have recorded over 11,000 disasters that are attributed to weather and climate and water hazards, involving more than 2 million deaths and almost 4 billion loss in the economy when I talk about in US dollars, of course. And also we have seen water-related events, either flood or storms, indicated here in blue, have increased also over the year. And that is why we will see that when it comes to the impact of climate change disproportionately in middle-income countries, specifically in sub-Saharan Africa and in Asia. And there are 9 health and socioeconomic indicators that usually are particularly vulnerable when it comes to climate change. And if you can look at it going down the columns here, you will see that the indicators that are mostly affected are extreme poverty, access to health, and dependency ratio. But also we see that there is also a depletion in access to basic infrastructure, such as even potable water. We see decrease in or increase in gender inequality, food insecurity, adult literacy, but we also see government and health status are depleting. But interestingly also, when we look at the burden of antimicrobial resistance, we see that it also disproportionately affects mostly the vulnerable populations in low and middle income countries, also specifically looking at sub-Saharan Africa and Asia. And the Graham report projected that estimatedly about 5 million AMR associated deaths and also 1.3 million AMR attributable deaths in the calendar year of 2019. And also the one common factor remain that the disproportionate burden in low and middle income countries will continue to increase if nothing is done. Now, I always refer to climate change as a threat multiplier because you will see here that climate change causes changes in pathogens growth and survival and virulence. But in addition, it also increases water scarcity during droughts, which can adversely affect hygiene and sanitation. And it also increases food scarcity, which can cause dietary shifts and also which can lead to unsafe food, as I have mentioned earlier. But it also leads to contamination of crops by feces due to high levels of rainfall and flooding. And this has led to what I refer to as that climate change and AMR have formed what I call the unholy alliance, and you'll see why just now. Now, if we look at temperature as just a particular health threat or threat multiplier, you will see that temperature is critical when it comes to bacterial processes and infections. And from a study that was done, you could see that as temperature increases with climate change, bacterial infection rates also increase and disease can spread to higher altitudes and latitudes where they were not previously found. But also we look at some of the examples from the table here, you will see that, for example, Campylobacter species and Salmonella have better survival rates with increase in temperature. And for example, when you talk about fungal infections, we see that Candida auris has gained thermal tolerance and increased salinity also in wetland ecosystems. But one thing to also look at for is E. coli and some of the escape pathogens have now developed the ability to grow even more optimally at temperatures between 32 to 33 degrees. And we have also seen an increase in horizontal gene transfers, which is facilitated by higher temperatures, but also the increased incidence and prevalence of infectious diseases will increase antimicrobial use, which will also lead to subsequent selection pressure for resistance. Now, in this graph, I want to show you an interesting study. So this study explored the role of temperature on the distribution of antibiotic resistance across the United States. I'm sure you are conversant with the map of the United States. The first figure, which is a heat map on the left, indicates here that it shows the resistant pattern. For E. coli, a heat map of resistant pattern of E. coli for all antibiotics. And the second figure on the right is a heat map of 30-year average minimum temperature. And the interesting thing that if not that I have told you this, you will see that these two images are almost an exact mirror of each other, which shows you the relationship between climate change and development of resistance. But below here, you will also see is a scatter plot of antibiotic resistance versus minimum temperature for E. coli and amoxicillin. And you can see that there is quite a positive direct relationship between the increase in resistance and increase in minimum temperature. While this other chart here shows or stratifies the antibiotic classes, such associations with associations between temperature and resistance, where we have seen the strongest resistance on fluoroquinolones and the weakest around the carbapenems. And the study showed that increasing local temperature and population density were associated with increasing resistance in common pathogens. Now, sorry, is somebody saying something? Okay, all right. Now, a 2022 climate report highlighted the rate of sea level rise in 3,000 years. The highest of Arctic sea ice. Sorry, I can get a feedback. I don't know where it's coming from.
I think
Okay.
just mistakenly unmute themselves. Yes.
All right. Now, there have been reports of antimicrobial resistance being released from permafrost, where normally we have not seen any of that in Siberia and Alaska. But we have also seen climate change is also causing ocean currents to move. And with them will move also antimicrobial resistant genes. And when we look at ship ballast, for example, we have also been, they have been implicated in the transport of antimicrobial resistance across seas. And using Vibrio as an example, which is of particular concern, Vibrio bacteria are marine pathogens that thrive in salt water and in warmer climates. So with increase in salinity and also increase in temperature, we are expecting to see increase in Vibrio bacteria. Also, an increase in sea surface temperature due to climate change can alter Vibrio abundance, distribution, and patterns of infection. And interestingly, both climate change and AMR will negatively affect the achievement and the attainment of sustainable development goals. And we have seen that climate change impacts include rising poverty, food insecurity, health issues, water scarcity, damaged infrastructure, rising inequalities, displacement, ecosystem collapse, biodiversity loss, and conflicts. And in terms of AMR, it puts the achievement of SDGs related to health, agriculture, animals, the environment, food security at risk. In addition, actions and objectives related to these SDGs are closely related to individual AMR content areas. Climate change, like AMR, is a One Health issue, as I have mentioned earlier, and thus the approach to mitigate this requires a One Health approach. And that is why I like the new revised definition of One Health by OLEP, which says that it recognizes the health of humans, domestic and wild animals, plants, and the wider environment. And it considers all of these as closely linked and interdependent. And the good thing with this approach is that it mobilizes multiple sectors, disciplines, and communities at various levels of the society to work together to see that the well-being is handled and also it tackles the threat to health and ecosystems as well. And that is why also the Pan-European Commission on One Health and Sustainable Development calls for the implementation of One Health even at community levels. And all settings where health policies are developed, it is specifically called it or it sorry, it has specifically called for a One Health approach in understanding and also mitigating the multiple threats of climate change and AMR together. And we must, as a matter of urgency, begin to see beyond the theory of One Health to operationalize One Health at every level and every sector. And here I want to show you just a very quick infographic. So this infographic speaks to human health influences that negatively and positively affect climate change. And you will see here, I have highlighted mitigation strategies related to AMR, specifically looking at improved cultivars and agronomic practices that do not require antimicrobials on farm water and also irrigation management, collective action policies and institutions, as well as training capacity to ensure that training capacities are built. And we look at livestock and fish related interventions to reduce the need for antimicrobials and increase the need for water, sanitation, and hygiene. And when it comes to the agriculture sector, we cannot overemphasize the need to reduce antimicrobial use in food animals by implementing vaccination, biosecurity, and good animal health husbandry practices. Also, we need to look at the importance of pre-treating the manures that we use in our farms because most of these contain antibiotic residue or antimicrobial residues. And also we must consider the pre-treatment of waste across the farm or slaughter houses and abattoirs to ensure that the discharges that are coming from this are not harmful to the environment, and also, of course, to ensure evidence-informed use of antimicrobials as pesticide for crops as prescribed by Cordus alimentarius. But here I want to also show you an infographic on the risk analysis and risk mitigation for climate change. And here you see that social factors, which include vector distribution and ecology, nutrient-dense diet, food safety, water quality, quantity, air quality, heat stress, and extreme weather events, all result in negative health outcomes. But here specifically, I have highlighted the ones that are related to AMR. As you can see here, you can see, for example, factors or diseases that impact on the use of antibiotics, mostly are viral infections, but coming from vectors and also malnutrition. And here, if you see also, like I have mentioned previously, on the need to emphasize environmentally sustainable solutions and also to look at health solutions that have dual mitigation strategies that counteract the effect of climate change as well as the effect of AMR together. So here I want to also show you more on the risk analysis and risk mitigation for AMR. And in this case, you can see that indiscriminate and overuse of antimicrobials are AMR-specific drivers, while suboptimal infection prevention and control, as well as wash and biosecurity, are AMR-sensitive drivers that facilitate the spread of AMR. And here I have highlighted the AMR drivers that affect climate change. So it's not only one way, it also shows that AMR can influence climate change as well as climate change can influence AMR. And here, for example, you can see that the recommendations that have been given for AMR mitigation are to have accurate progress in countries, to innovate secure future and solutions that are sustainable, also foster collaboration around effective actions and all of that. But interestingly, all of these factors I have mentioned, if I replace them with climate change, they still apply. Now, with all of these suggestions and all of these interventions, this begs for the question that why is it that most of these successful interventions are not being implemented at a larger scale? And some of the reasons are very specific and quite very profound in the sense that, for example, there is always a lack of political and policy commitment. And why do we have this issue is because there is insufficient surveillance data to demonstrate the extent of the problem when it comes to climate change and AMR. There's also a poor understanding of the consequences of AMR and climate change together. And also there is always the lack of convincing business case for why government should invest on this. Now we talk about another issue, which is the lack of local ownership and engagement or behavioral change from stakeholders for several reasons. Some of the reasons are because there is suboptimal knowledge, attitude, and practices around AMR and its consequences, but also insufficient surveillance data to demonstrate the extent of the problem as well. There is lack of acknowledgement of the importance for implementation research to get sustained change, and also the lack of human infrastructural and operational resources as well. So it is important to know that scalable, successful interventions are based on research that has both an intervention and an implementation component to it. And that is why, as ICAS, we work with different low and middle income country partners to reduce drug-resistant infections in low and middle income countries. And we see that for us to be able to do this, there is a need for solutions that are evidence-based, context-specific, cost-effective, sustainable, that covers the One Health spectrum, but most importantly, also close the gap between policy and practice through a holistic and cross-sectoral approach. And just to give you a general perspective of our activities, currently we have over 55 projects in over 25 countries and span across the entire One Health sector. And we can see that we work with over 150 plus partners across different regions of the world. Now, to give you an example of one of the interventions we are doing specifically on the integration of climate change into AMR lens, is that we are trying to develop solutions for integrating AMR into global challenges, for example, AMR and climate change. And to do this, we want to document knowledge and identify implementation gaps at AMR and climate change interface in livestock and aquaculture sectors in low and middle income countries. And how do we intend to do this? The first thing we are doing at the moment is that we are creating a hotspot map for low and middle income countries that shows the area of intersection between climate change, AMU and AMR. And also we have just received some of the new reports on the scoping review study that shows where we are at, particularly in low and middle income country when it comes to research and studies around AMR and climate change. And we're also trying to test interventions specifically targeting climate change and climate change or climate smart interventions, sorry, in connection with livestock and aquaculture. And at the end of the day, we intend to develop a resource material that will be able to inform and guide on the integration of AMR and climate smart research and interventions for livestock in low and middle income countries. And we have also recently established what we call a community of action that will serve as a platform to discuss and bring ideas together when it comes to AMR and climate change. I will just give a minute for anybody that wants to scan the QR code to do that quickly. Okay. So with this, I want to conclude that systematic generation of data and evidence on the interlinkage or the interlinked impact of climate change and AMR, as well as very innovative solutions to address them are quite needed very urgently. And the mitigation of both climate change and AMR requires very specific, unequivocal political leadership and commitment, strong global and local policy frameworks and governance that informs this, evidence-based One Health solutions, implementation research to adapt successful interventions to country contexts, because we have come to realize that we cannot operate a one-size-fits-all kind of solution. And we must also have coordinated, multi-pronged, multi-stakeholders, multidisciplinary partnerships, suspend sectoral interests for the public good. And lastly, I want to say climate change and AMR should leverage on the political and public health visibility that they have been able to gain in recent time and join forces together for mutual benefits. And as always in the course of presentation, I will always want to acknowledge all our partners that have contributed to the work that we have done so far. With this, I want to say thank you to the organizers for giving me this opportunity to share a little on what we have been doing. Over.
Yeah, thank you so much, Dr. Chai. That was insightful and yes, very enlightening. We are so much grateful for your time. And I would open the stage up for questions and answer. So I would invite our trainees in case they have questions and answer. They can, questions. They can go ahead and then Dr. would definitely provide answers to them.
So when we talk about the impact of change and the distribution of vectors, it will interest you to know that, in fact, vector distribution is one of the most closest direct link of the impact of climate change on health. In fact, that's one of the most studied aspects of the impact of climate change as well. Just to give you an example, so with increase in flooding, for example, there is always an increase in the risk of multiplication of bacteria, of parasites such as Plasmodium that results to malaria, for example. But interestingly, that also leads to vector-borne diseases, a proliferation in the number of ticks, and all of that, which, of course, if there is increase in the population of these vectors, we also expect to see an increase in transmission of what they are carrying to humans and animals. And also the impact of climate change on health is one that is quite very dynamic. I did a research recently where we studied the impact of the roles of environment, particularly looking at the impact of climate change on natural systems. And what we did was that we looked at the impact on wildlife setting in the Kruger National Park of South Africa while I was in South Africa. And we realized that with the increase, for example, in temperature, in water, and all of that, we have also seen a shift in the host species that are mostly affected by one pathogen. So to give you an example, using Bacillus anthracis in the Kruger National Park in South Africa, over the years, the most affected host species has been a particular species of antelope called the kudu. But then from 1993, we have seen a significant shift from the kudu. So to give you perspective, over 75% of animals that were affected were the kudus before 1993. But from 1993, the kudus accounted for less than 10% of the mortality when it comes to anthrax. And then we started investigating what caused the shift. And then there was a shift to impala, which is another species of antelope that now constituted the majority of the mortalities in Kruger National Park. We started investigating and we realized that because there has been a change in the climate patterns, there was a change in rainfall, which affected the species of plants that were growing. And because of that, also the elephants in the park started feeding on grasses they were not previously feeding on, for example, and they brought down trees and all of that. So usually the kudus browse at about 6 meters, impalas browse at about 2 meters. So elephants started bringing down the trees to the level that impalas browse. But one important factor that usually affects the transmission of anthrax in the Kruger sector is the blowflies. Now, because there has been a change in the ecological setting where the trees where the kudus browse have now been reduced to the level below their browsing range, the blowflies were no longer depositing the Bacillus anthracis on the leaves where these animals would be able to browse. So it made the pathogen or the bacteria more accessible to impala and less accessible to kudus. That's now changed the whole dynamics. And the increase in flood and all of that also increased the population of the blowflies in the park, which now increased the multiplication, and we have been seeing a lot of outbreaks. And this is a common thing. For example, when you talk about a lot of tick-borne diseases and vector-borne diseases, such as theileriosis, you talk about anaplasmosis, we have also seen a significant increase because of flooding activities in such settings. So that is just a straight example of the direct link between climate change and increase in vector activities. I don't know if I have answered your question, Victor. I can give tons of examples on vector bonds. Okay.
Does anyone else have any other question? Feel free to either.
Yeah, I can see a question around fish therapy. So when it's to the intersection of climate change and AMR, there have been a lot of advocacy around the use of alternatives. I know a number of teams in different countries, one in South Africa, one in Georgia. I was with them last year that are working on phage as an alternative to antibiotics. And this is also a very big space in the AMR world and the intersection with climate change because of the impact of AMR on the climate. And it's something that is growing quite rapidly, and we're beginning to see promising results, just that most of the evidences have not been peer reviewed at the moment, and there is no let me say, sufficient body of evidence to support that, but we're beginning to see a lot of promise around that.
Okay. Does anyone else have any other question? You can type in the chat or you can raise your hand to ask. Okay, so I have some questions too from my hand. Thank you so much
Yes,
for
please.
the presentation. So I noticed we were talking about the One Health approach. There's been so much focus when it comes to the human aspect, when it comes to the animal aspect, but the environmental aspect has been largely ignored. So I wanted to ask, what is ICAS, or what are you currently doing to ensure that the environmental aspect also gets the attention that is needed? Although I know that there's currently a rise in the wastewater surveillance, AMR wastewater surveillance going on in the past few years, especially after the COVID-19 happened. but what else is ICAS doing, or what are some of the efforts that you are doing to ensure that the aspect is also given enough attention?
Thank you so much for that very important question. So I didn't spend so much time on the ICAS map for you to see all the activities that we're doing. So when I first joined ICAS, we had only one project that was truly an environment project, which was targeting the treatment of manure from poultry farms to reduce pest-resistant bacteria, but also to reduce residues before applying it to farms, especially for organic farming. But then just between then and now, we have actually specifically one thing that we don't usually do in ICAS is to put out a request for proposal. But for that particular, to increase the portfolio, and also because of the growing need to invest in that aspect, we launched a request for proposal where we specifically targeted the environmental dimensions of AMR. And because of that now, I think 4 additional projects in different countries around the world that are starting on antimicrobial, on environmental dimensions of AMR. And also what you have said is something that is very important. I had a meeting with UNEP some weeks ago, where we spoke specifically about the need for environmental sectors to be the drivers. Because what happens most of the times is that we have a human health project, and then we think of, oh, how can we bring in the environment people into it? There is hardly an environment project that thinks of, oh, how do we bring the human health people? So when it comes to the setting of the agenda, initially it was always done by human health and then they bring in animal health. But over the years, the animal health sector also started designing the agenda and designing their interventions and projects and bringing a human perspective to it. And that is what we are currently advocating, like I mentioned to the UNEP counterparts, about the need to be on the forefront of doing that. And interestingly, I'm not sure if you have seen the guideline that was developed by UNEP and WHO, specifically on wastewater management and treatment and surveillance. And we are beginning to see more of this. So from ICAS as an organization, in partnership with our low and middle income countries partners and other global players, we are actually ensuring and seeing that the environmental dimensions of AMR is coming to the fore and not just an afterthought.
Thank you very much for that. It's good to know that a lot of work is being done. I also have another question, but this time around is more youth related. So we know that in the fight against AMR, we need to like involve our youth, like what we are currently doing in NACI, where we're organizing a 4-month training program for our youth on antimicrobial stewardship, how to do AMR research, like dissertation writing, data analysis, use of bioinformatics, and all of those things. And this webinar, for instance, is also part of the AMR stewardship program that we are doing for them currently. So I don't know how has ICAS also been involved in engaging youth. For instance, assuming there are youth here that maybe most of the people here are like undergraduate students. We have very few master students, but some may like want to work with ICAS, for instance, maybe on internship and to get more hands-on field-based experience. So are there opportunities like this in ICAS, and what is the process?
First, talking about youth advocacy when it comes to AMR. So one thing we have done over time is to partner with a number of institutes and organizations in events and on the need to amplify the voice of the youth. So like I've most mentioned in so many forums, is that the youth are amplifiers. So if you take anything and put it in the hands of the youth, they amplify it. And if you want a message to be amplified, give it to the young people, they do that. And that's something that a lot of organizations, including ICAS, are beginning to identify and acknowledge. So one thing maybe to mention is that we have an interesting model of working, in the sense that, for example, we do not work directly with researchers or just directly with organizations. We have what we call the top-down, bottom-up approach, where if we come to a country, so if you look at the map, most of our partners, apart from funding partners, they countries. So that's why we have a list of countries where we work. So if, for example, a country approaches, they want to test an intervention on this particular thing, they work in collection. So, for example, I gave an example of the Manua project, which is in Tanzania. We were approached by the Ministry of Agri, but the partner or the institute that is implementing most of the activities is the Sekona University of uh, of Agriculture in Tanzania that are implementing that in relation to different stakeholders in the country, and through that they are able to train students. They're able to have master students, in some instances undergraduate students, PhD students, some instances even postdoc are able to connect in that way. So through that we have been able to build a lot of capacities within countries. So for example, in your institution, let's say you're based in Nigeria, if we have a project with the Nigerian government, for example, we can say, oh, we know another stakeholder that you can partner with in this aspect of youth advocacy, for example. And then with that, you are able to connect with them and form part of the stakeholders for that particular project, and you are able to deliver with it. So we also have, I think, a new project which we just started. It's a small project on sustainable development, no, sustainable impact, sorry. And it's done by I'm sure you know, the One Health Development Initiative in collaboration with other institutions. So usually that's how we work. That's a different model of working because it was through a request for proposal. So there are different ways. And when you talk about career in ICAS, usually we have what we call student assistants, but most of our student assistants are either finishing their undergraduate degree or just finishing their master's degree, and they come as student assistants. But apart from that, in ICAS, you can see more on our page when it comes to career in ICAS. In ICAS, we have people that are pharmacists, we have veterinarians, we have people that are medical doctors, people that have just public health background, microbiologists, name them. So it's quite an organization that is very diverse, and people from over 20 something countries. So it's a diverse organization, which I think could be beneficial for anyone that has a vision of joining ICAS someday.
Yeah, thank you very much. And I do
Yeah,
that they've gained one or two things from what you've said. Then I have one last question, but this one is more to you. So,
yeah.
because we have mentees here and we want them to learn from people that have gone ahead of them. So, in your journey so far in the field of climate change and public health also, um, what are some of the challenges that you faced as a person? What are the ways you've been able to overcome them, and some of the advice you would give to the younger ones who are also planning to pursue this line of interest?
Okay, so I think there is no easy answer to this because talking about my journey would keep us here for the next 2 days. So starting, just to give a background, I actually did my undergraduate study in Nigeria from University of Maiduguri, where I did my veterinary degree. And I always tell my mates, even while I was there, and I always say anywhere I'm called to talk in this kind of forum, to say that first, you don't practice for a race during the match. So most of the times you plan for it way ahead. You don't wait till it's time to plan. So where I am today, actually, I think the planning started since I was an undergraduate, because I always had the mindset that I didn't just want to be just the regular veterinarian to finish, either go for private practice or be fixed in a clinic. It's something that I have aspired, and I specifically started looking at for what I needed to have to be able to get what I want. So what are the requirements that I would need in the next 10 years to be in this position, for example? And that I was able to do. So I got a veterinary degree. But then after which I did my compulsory 1 year service, and then I started working with Christian Aid UK as a livestock officer. And I think that actually changed my perspective, because as soon as I got in, I realized first the need for a higher degree. So even though I was paid quite good money, and it's something that I need to buttress here, I was paid quite a good amount of money, but then I decided to leave all of that to go and do a master's. And I remember when I started doing the master's, I had to think twice if I have made the worst mistake of my life, because from earning this amount of money, I'm now earning this amount under my scholarship, because I got the Mandela Rhodes Scholarship in South Africa. So I moved there to do my master's. But then one thing I came to realize in the course of doing that is the principle of delayed gratification, which is that I was able to sacrifice my position from Christian Aid UK to be able to attain to first get my second degree. So when I went, I did my master's. I did it at the University of Pretoria, and my funding was from the US. So I remember, just to give you perspective, 2 weeks into the start of my master's, I walked into my supervisor's office and said, I would like to do a PhD immediately after my master's. And she was like, is everything okay? You have not even developed your proposal. Why are you talking about a PhD? We have not even started your master's. Let's be sure you are able to finish your master's first. But that actually prepared her mind to be able to know that I had a plan and I had a vision. And then I think one thing I took advantage of, I spent a total of 5 years to do master's and PhD combined. So I did my master's and PhD. Everything took me just, I think it was a little less than 5 years to do everything. But interestingly, in the course of doing that, within the 5 years, I also gained 5 years of being a lecturer. So I was a full-time lecturer, I was a full-time student. How I did that, most people ask me, I don't know. But then I was able to do that, such that I took every advantage of everything I needed to do. And in the course of these 5 years, just to give you a perspective, I was also, I went to do a fellowship in the US, as you have read my profile. In the course of these 5 years, within the 5 years of doing my master's and PhD also, I did basic training. I did a basic training in epidemiology with the institute. I still went back to do an advanced epidemiology with them. I still went back to do an applied epidemiology with them. I still did a program with the University of Hamburg on agent-based modeling and all of that. Still did a lot of crash courses on climate change, environment, and all of that. Still within the 5 years that I was still doing my PhD, these were all outside my PhD. And at the same time, I was teaching undergraduates. And I was, when I started my PhD, I was also teaching master's students, which I do. But this gave me also a lot of advantage, that when immediately, I think it was the last year of my PhD, that I applied for different positions, and then I applied to ICAS and moved to ICAS. But when I was moving to ICAS, the minimum requirement they needed post-masters was 5 years. So the good thing was that I had that in the course of doing that, of doing my work, which I was able to apply. So what I say is the need to take advantage and to maximize whatever you find yourself doing. Sometimes you might not have a lot, but that little you have, you make the most of it. That's what makes the difference. And in the course of doing that, I remember when I was about to leave University of Pretoria, I tendered my resignation and said I wanted to leave. The university said, we are only going to allow you on the condition that you remain an extraordinary lecturer with us. I was like, yeah, sure, I can do that. And as soon as I left, I also got a request from the University of KwaZulu-Natal in Durban, in South Africa, to be a honorary lecturer supervising postgraduate students, which I graciously took. So a lot of things contributed to what I am doing today, but I will say that I think you can never neglect the place of having good mentors and people you look up to. For me, I did not have this advantage of having this forum where you are now bringing a lot of people to have this. Even as an undergraduate, I had to fend for all of this myself. And I think that is something, this is an advantage that everybody on this course should take, where you maximize this training you are getting. This training you are getting is already going into your CV. So when you are graduating as an undergraduate or master student, you already have something to demonstrate. And you also have the ability to reach out to people. So it will interest you to know that even the ICAS job I got it on LinkedIn based on my connections. And I have met a lot of world leaders. I talked about the meeting I had with UNEP recently. They reached out to me. It was on LinkedIn due to the connections and all of that. So I would say you should also leverage the importance of building good networks. That actually helps a lot, and not neglecting the place of having good mentors as well.
Thank you
Over.
so much. This is a very valuable advice, and we do hope that everyone here would take this to heart and run with it. Really appreciate your time. We have one question in the chat. I don't know if you can see it.
Yeah, I can see that. I think the question is saying that there are some pathogens that are resistant to climate changes. I don't know what they mean by, and this can survive for years. Is there a discovery so far that climate can kill some pathogens instead of enhancing the genetic resistance? So you need to realize that just like with bacteria or every other organism, there is always the ability to adapt. And that's what makes organisms organisms. I mentioned, for example, with Vibro and all of that, previously, there is level of salinity they are able to tolerate, but now they have gained even increased uh, tolerance for salinity. They have gained increased tolerance for increased temperature. So some bacteria at the initial stage of evolving and adapting would die, but eventually these bacteria will be able to develop some level of resistance and tolerance, and able, if they are going to continue to survive, they will able to. So even some bacteria that are found in some of the Arctic regions, for example, I have mentioned with the melting of the permafrost and all of that, a lot of bacteria are coming back to life. Bacteria that have been dormant for years, we are beginning to see them resurfacing. I gave example with Bacillus anthracis, places in the Arctic where we have not seen Bacillus anthracis before, that have been buried under layers and layers of ice and now beginning to resurface because of the melting of ice and all of that. So a lot of bacteria, some will die in the process of evolving, but a lot will be able to develop thermotolerance and also increase tolerance for salinity.
Okay. Yeah, thank you so much, sir. Really appreciate your time. Thank you so much, sir, for taking our time to be here. We really appreciate you. And I'm sure everyone here also appreciates you. I've been saying thank you in the chat. So really appreciate
My pleasure.
and